Critical Limb Ischemia by Lennon Calliope, Staff Nurse, D4 Vascular Ward. Critical limb ischemia, a severe obstruction of the arteries which markedly reduces blood flow to the extremities, affecting hands, feet, and legs. A very severe condition of peripheral artery disease (PAD) and needs comprehensive treatment via vascular surgeon or vascular specialist. PAD is caused by atherosclerosis, the hardening and narrowing of the arteries over time due to the buildup of fatty deposits called plaque. A chronic condition that results in severe pain in the feet or toes, even while resting. This pain, which is also called rest pain, affects the legs and can temporarily be relieved by raising the legs while resting with the help of a pillow, hanging the leg over the bed, and getting up to walk around. Warning signs and symptoms. First, resting pain or numbness in the feet. Shiny, smooth, dry skin of the legs or feet. Thickening of the toenails. Absent or diminished pulse in the legs or feet. Open sores, skin infections, or non-healing wound. Tissue loss or dry gangrene of the legs or feet. Reduction of temperature in the area of feet and legs. So, these are the examples of the warning signs and symptoms of the critical limb ischemia. The gangrenous non-healing wounds, diminish or absence of foot pulses, ischemic legs, and numbness of the feet. So here are the risk factors of critical limb ischemia. Smoking and drinking, high cholesterol, high blood pressure, excessive eating or unhealthy eating habits, diabetes, overweight or obesity, sedentary lifestyle, and family history of vascular disease. Also, men over 60 years and women after menopause. So those are the conditions that will put a person at higher risk of having critical limb ischemia. Next is how critical leg ischemia is being diagnosed. First is auscultation, the presence of a bruit or whooshing sound in the arteries of the legs is confirmed using a stethoscope. Ankle brachial index. The systolic blood pressure in the arm is divided by the systolic pressure at the ankle. Doppler ultrasound. This form of ultrasound can measure the direction and velocity of blood flow through the vessels. Next is CT angiography, an advanced X-ray procedure that uses a computer to generate three-dimensional images. Magnetic resonance angiography, or MR angiography. The patient is exposed for radio frequency waves in a strong magnetic field. The energy that is released is measured by a computer and used to construct two- and three-dimensional images of the blood vessels. And lastly, the angiogram, an X-ray study of the blood vessels, is taken during contrast dyes.
The standard treatment is surgery to remove the blockage, using lasers or cutters to destroy the deposits, or miniature balloons to expand the narrowed arteries, or bypass surgery to give the blood a different route around the blockage. But some blockages occur in hard-to-reach places, or the patient is just too unwell for an invasive procedure. In fact, almost a third of sufferers of critical limb ischemia have no options for treatment, and most of those patients end up needing to have their limb amputated. But there could be another way.
And now we are down to treatments. First is medications. Several medications may be prescribed to prevent further progression of the disease and to reduce the effect of contributing factors such as high blood pressure, high cholesterol, and diabetes, and most certainly to reduce the pain. Medications that prevent clotting or fight infections may be prescribed. Examples of the medications are antiplatelet agents, statins, and peripheral vasodilators. The second type of treatment is endovascular. These treatments are the least invasive and involve inserting a catheter into the artery in the groin to allow access to the diseased portion of the artery. One of its kind is angioplasty or stenting. Angioplasty is done to open the blockages by inserting small balloons into an artery using a catheter. The balloon is inflated in there, and as it inflates, the artery stretches and opens up, thus improving the blood flow. If required, a metallic device known as stent is then inserted to maintain the expansion of the artery. Second is atherectomy. Laser atherectomy involves small pieces of plaque being vaporized with the help of the tip of a laser probe. Second is directional atherectomy. In this method, a catheter with a rotating cutting blade removes the plaque from the artery physically. The third and the last form of treatment is surgical treatments. If the endovascular therapy is not favorable for the arterial blockages, then surgery is recommended. First of which is bypass surgery. This typically involves bypass around the diseased segment with either a vein taken from other parts of the patient or a synthetic graft. And lastly, amputation. The last option of treating critical limb ischemia would be the amputation of a part of leg or feet. In some patients, the blood flow can't be reestablished, and amputation becomes the only option to cut off the gangrene or reduce the severe pain. Amputation reduces the risk of spreading the gangrene to the other parts of the body.
Your doctor begins by inserting a guide wire into the femoral artery in your thigh. Sometimes the leg opposite the side of the symptoms is used for initial access. A tapered sheath is then inserted over a wire to provide easy access into your blood vessels for the small tools required to perform the procedure. The wire is then advanced to the area of blockage, and your doctor will cross the blockage with the wire and a catheter. Once the wire has successfully crossed the blockage, a deflated balloon is advanced over the wire to the site of the artery occlusion. When the balloon is inflated, it opens the blocked artery and restores blood flow. The doctor collapses the balloon and removes it completely. Sometimes, if the artery remains partially blocked, a stent or metal scaffold is used to keep the artery open. In its collapsed form, the stent is loaded onto a catheter that is then inserted over the wire to the site of the artery blockage. The stent is then opened, detaching from the catheter and allowing the catheter to be removed, leaving behind the open stent within the artery. The stent will help prevent the blockage from reoccurring. For longer artery blockages, several stents may be required. A new variation of this procedure has been developed for more complicated artery blockages. The blocked blood vessel is approached from both the femoral artery above and from the foot or ankle below. Wires and catheters are advanced to the blocked artery from both directions until the blockage is crossed either from above or below. Once the blockage is crossed from either above or below, the procedure is completed as usual. The doctor can then inflate an angioplasty balloon and stent, if needed, to reopen the artery. Once the artery is satisfactorily opened, all the tools such as wires, catheters, and sheaths are then removed. The femoral artery access in the thigh is sealed, and the patient can usually go home within 4 to 6 hours.
To reduce the chance of recurring critical limb ischemia, the following medical management should be followed. First is comprehensive lifestyle modification, eating a healthy diet, supervised exercise programs, maintaining a healthy weight, cutting down of alcohol, smoking cessation, nicotine replacement therapy, foot care, management of blood pressure and diabetes. In conclusion, critical limb ischemia, when detected early, can be cured without any impact in the future. The treatment depends on the severity and many individual parameters. Whenever someone develops ulcers or has pain in the legs or feet while walking or resting, should see a vascular specialist or surgeon as early as possible. The earlier the diagnosis can be done, the earlier treatment can be initiated without any serious consequence. Thank you so much for listening and sharing your time with me. Have a great day.